Media. Okay, while we wait for media, I have the slide here. Let me just continue. Let me just start something. What are the objectives we want to see today? We'll be defining what malaria is. We'll be talking about the malaria burden in our times so as to understand the enormity of this topic we're talking about. I was talking about the mode of transmission, the signs and symptoms, discovered clinical manifestation, education, and prevention of malaria. Next slide. By definition, malaria is an acute or subacute infectious disease caused by one of four protozoans, medical jargon. Plasmodium, falciparum, vivax, ovale, malariae. There's another one again that is new, but that is not for our consumption. It is mainly transmitted by a female Anopheles mosquitoes. Now look at the second definition. It says malaria is an acute febrile illness caused by Plasmodium parasites, which are spread to people through bites of infected female Anopheles mosquitoes. Now it says it is preventable and curable. Remember, our topic is malaria prevention. Next slide. Now, talking about malaria burden. Infectious disease like malaria has been a public health burden for generations, though there have been tremendous advances in its management treatment. But the public health challenge still lingers. Malaria is a major public health concern in Nigeria today, with an estimated 68 million cases and 194,000 deaths due to the disease in 2021. Nigeria has the highest burden of malaria globally, accounting for nearly 27% of global malaria burden. The risk of transmission exists throughout the country all year round. However, the incidence of malaria is highest in the northern and eastern parts of the country. We also have it here in Benue. Next slide. Malaria causes about 11% of maternal death in malaria complicates 8.4 to 58.1% of pregnancies in Nigeria. It is not correct that a woman dies because of malaria. She gets pregnant and before the end of her pregnancy, she dies of complication of malaria. So that's why we're here talking about this very problem. In 2021, Nigeria accounted for about 26.6% of malaria cases and 31.3% of malaria-related deaths globally. They said over 50 million and 100,000 malaria cases and deaths occurred in Nigeria in that same year. Now, under 5 children are the most vulnerable group. They experience about an average of 2 to 5 bouts per year. Bout means, episode of this malaria. Those children that are under 5, they experience about 2 to 4 episodes of this malaria per year and account for about 90% of national mortality from malaria. Next slide. Now, this is what happens to, this is what malaria does to a mother and to the child. We have maternal anemia, low blood, level of blood in the system. Cerebral severe maternal mortality, that's death of the pregnant woman. Recurrent or new plasmodium infection. For the child, what happens? This woman risks the chance of losing that child. We call it abortion, but you call it miscarriage. Thank you very much. It is called abortion, loss of a child, or miscarriage that you call it. It is called abortion in medicine. There is stillbirth. Malaria can result to stillbirth. Preterm delivery, a delivery before time, can occur as a result of malaria infection. We have low birth weight. We give birth to a child that is so small for age. Then neonatal mortality. That's the death of a child that is from 0 to 1 month of age. Congenital malaria. Malaria can be transmitted by the mother to the child during or before delivery. Then we talk about infant mortality, the death of a child that is below 1 year. Then anemia also, low blood in the system, poor developmental or behavioral outcomes, how malaria can affect the behavior of that child. Next slide, please. Now, how is this malaria transmitted? It is a common knowledge that it is through the bite of a female Anopheles mosquito. Now, she must bite somebody who has already gotten the malaria disease in the system. After that first bite, the bite is actually feeding. Oh. She goes looking for food, and the food is my blood and your blood. And she bites. If I have it, she goes to bite Henry or anybody. Henry now gets the malaria disease. That's just the whole way of transmission. But there's other ways that we can also get this disease. It could be through blood transfusion. It could be by the use of contaminated dirty needles or syringes. This reminds me of HIV. Praise the Lord. This reminds me of HIV. We just finished praying for our young ones who may be under the attack of sexual immorality. Friends, HIV is as close to you as the clothes you are wearing. By the mercy of God, that's where I work. It's as close to you as the clothes you are wearing. Apart from being a sin, committing sexual immorality, there is also this, that you will live forever. Abstain sexual immorality for your own good. Praise the Lord. I move on. Next slide. Okay, this is just a diagram showing us how the malaria is transmitted. It bites somebody who may have full immunity, because there are some blood groups, genotype, people with genotype, especially AS people, they hardly come down with malaria because of the sickle nature of their blood cells. So those ones, they may have malaria, but they may not manifest it. And people like us that are AA and others like that, after biting the person that has the disease, comes to bite me, and you see me coming down with malaria. But it doesn't mean that those AS will never come down, no, but just that they rarely come down with it. They go to bite the next person, and then in the body, there are some stages that this happens, even in the body of malaria, before it comes to bite the next person. That's just a summary of the transmission. All we need to know here is about that malaria is transmissible, and the vector is what? Mosquito. Medicine says female Anopheles mosquito. Now, what are the clinical manifestations? Too many English. It is signs and symptoms. What makes you feel that you have malaria? Basically, this person will come down with fever, will have headache, will have chills. This person may be vomiting. This person may have diarrhea. If you have stomach upsets, there are different kinds of symptoms. And when you have that, you may be having malaria. Lord. Next slide. Now, what is the treatment for malaria? Malaria is a treatable disease. We have said it before. There is a combination of artemisinin-based combination, ACT. Praise the Lord. Medical jargon, right? That is used by your doctor to take care of you. But please, I wish I would have highlighted this one. Or visit the nearest clinic for treatment. Because there are other signs that can mimic what malaria does. Please visit the nearest clinic or your doctor. Next slide. Complications of untreated malaria. Malaria can lead to liver failure and jaundice. We have shock. Shock is a sudden drop in blood pressure. We have pulmonary edema, where that can affect our respiration, our way of breathing, when the lungs are congested. We have low blood sugar, hypoglycemia, kidney failure, swelling, rupturing of the spleen, and can eventually lead to death. Next slide. How can we prevent malaria? This is the core of this presentation. We have vector control. They say is the main approach to prevent malaria and reduce transmission. Two forms of vector control are effective for people living in malaria endemic countries. Insecticide-treated nets, also known as what? The long-lasting insecticide-treated nets, which prevent bites while people sleep and all of that. Now, we also, let me just summarize it. We also have the use of your insecticide. People use snipers, people use various sprays. Now, the mosquitoes are found on the ceiling and on the wall. That tells you how to even attack them. Now, there's another way to prevent this. It's about having a very good environment. Sanitize your place, free them of every stagnant water. A combination of this is what, sorry, next slide. Places like these are very, very good places for mosquito to thrive and then come and harm us later. So a combination, next slide please. A combination of chemotherapy and malaria prophylaxis also works well in preventing malaria. There are drugs that are prophylaxis. Prophylaxis means they help prevent the incidence of malaria. So when you have any of these signs, see your doctor, they will give you any of this prophylaxis, and also encourage us to use our nets. I am an AA person. I have been falling down to malaria, but I started using nets in my house. I have not fallen sick to malaria. So that is the importance of the use of the nets. Praise the Lord. Now, there's this very warning that we just highlighted here. They say we should note, prevention is not only better, but also cheaper than cure. The way drugs are very expensive these days, we encourage that please prevent going to the hospital by using insecticide-treated mosquito net. Next slide. I think that's the end of the presentation. Thank you very much. Questions, please, if any.
Okay. So am I to entertain questions, or rather are we to entertain questions? Okay, if you have a question, please kindly meet him after service. Just like you will meet a health personnel when you start feeling feverish. Don't treat malaria by yourself. Almost every Nigerian is a doctor that treats malaria.